Today on the podcast, I interviewed my husband, Mike, about his experience as a man navigating male factor infertility. This is a rare peek into the mind of a man going through this vulnerable time and upfront insight on an often avoided topic. Although this journey was lonely for him, with 1 in 10 men struggling to conceive today, he realized after his experience that it's important to share if he can help even just one other couple have the family they dream of. We discussed what it was like for him to find out about his sperm, what the 6-year journey to conception was like, what support he received and wished he had had, and what he would recommend other men navigating this major obstacle do. He has such wisdom to share and practical tips for men and their partners as they navigate male factor infertility. Let's dive in. Welcome to Healthy as a Mother, the podcast for becoming and being a mother, with your co-hosts, Dr. Leah Gordon and Dr. Morgan McDermott, two naturopathic doctors who get it.
Each week, we teach you how to be the healthiest mother you can be, from fertility and preconception to pregnancy and birth prep, through postpartum and throughout motherhood, empowering you with the natural health guidance and education you're not getting elsewhere, so you can confidently navigate the broken system at large.
The real, the raw, the untalked about. And remember, this information is not intended to diagnose, treat, or manage any disease. Always consult with your doctor before making any changes. Okay, before we hop into male factor infertility, honey, why don't you tell everybody a little bit about yourself, where you're from, what you like to do, just so people can get to know you a little bit.
So I am from Florida originally. I was born in St. Pete. I was raised in Miami in South Beach. And when I was 16, I moved to Colorado. And I finished high school at Aspen High. And then I went to CSU, where I met you. There for 5 years. And then I went to Seattle for my first job. And then
Which was what?
Refueling subs for the Navy.
So you were a nuclear engineer. You're so humble.
And then in 2013, you and I relocated to San Diego. And I've been working in biotech since. So,
amazing.
Yeah.
Awesome. Well, why don't you, some people know our story of how we kind of found out about your sperm, but for those of you who don't, I'll just recap it quickly, and then I want to ask you questions about it. So I was in naturopathic medical school in my second year when we were doing a sperm analysis class. We had already been married, moved to San Diego, and we weren't trying to conceive at that time in our lives. We just assumed we'd get pregnant as soon as I graduated school. And we needed a sample for school. We were analyzing sperm under the microscope. So you gave me a sample. And that day, I basically discovered that you had no viable sperm, at least in the samples that I took. It was one of the worst days of my life. And then I had to break the news to you that day. And we don't get your perspective from the story very often. So why don't you kind of walk us through what that was like to hear about that from me?
Well, I picked you up from med school that day, and I could tell something was immediately wrong. And then when you told me, I remember you literally said, "This doesn't make you any less of a man," but, and I initially kind of shrugged it off because I had been saunaing a lot. Like, I love the sauna. So I can go in the sauna for an hour and a half, 2 hours at a time. And so I'm like, that's a hot traditional sauna. So when you told me that, I originally thought like, all right, well, that's just got to be the sauna. So I wasn't too concerned. I was like, all right, well, we'll just stop sauning, and then it should be fixed. So I did that. I stopped sauning for like 3 months, and then we checked again, and there was nothing. And I was expecting to be completely normal at that point. So it takes 3 months. I think we checked at 4 months. Nothing. Like nothing.
And what was that like for you?
That was really concerning. That was devastating. Because I all of a sudden have a massive problem that I didn't know I had. And so that was like the world closing in, because at that point we decided to start trying. Like that was like at the point of our lives where we're like, all right, let's actually try to conceive here. And then it's a big decision to do that. It's a huge decision to say, oh, this is the moment we're going to try to conceive, and then to find out that you have no sperm. Like under the microscope, you don't even see sperm. They're
Mm-hmm.
like not there. So it wasn't like I have a low sperm count, or they're not like swimming fast. There was like nothing there. So I think the real heavy hitter for me was 3 months, 4 months after you told me that I didn't have sperm in my sample,
Mm-hmm.
and that was like, all right, we have a real problem. And
Mm-hmm.
then when we started to investigate that, I mean, we went to a conventional doctor in San Diego. They did a test. My sperm count literally said zero, with the number zero, for motel sperm. And so they did a bunch of tests, and they said, well, you have bilateral varicoceles, so varicoceles on both sides. They said that could be contributing. They
And for
set up.
anyone who doesn't know, varicoceles are basically swollen veins around and near the testicles that can cause sperm issues. So we found that you had two, one on either side. And at the time, like, how did that feel to receive that diagnosis?
No, it didn't bother me at all. Not anybody. Most people who weightlift, especially legs, they are most likely going to have some version. It might not be like a super bad case, but I mean, I've been, you know, lifting heavy since I was like 11, 12. So it
Mm-hmm.
wasn't a big deal to have that diagnosis, because just because you have varicoceles doesn't mean you don't have sperm. It just means, you can have fewer count, or maybe not as good quality. So that doc wanted to go in and do basically fix both sides, bilateral varicocelectomy. And that procedure, um, it's not the most fun, that procedure. They go in through your pubic area, and obviously it didn't feel the procedure during the procedure, but recovering from that was pretty tough.
Well, and we didn't do that right away. We tried
Oh, that's
functional
true.
medicine
That Yeah,
stuff for
that
a
is
while
true. We
before we
did.
resorted to that.
Yeah, we went down the toxicity and the heavy metal path. So what
That
we
was
tested for
much
heavy.
later. Yeah, that
Yeah.
was much later. After your
Um,
surgery.
yeah.
hmm
Um, so, I mean, you want to go in chronological order? It's
No, I'm just saying, like, I know you can share kind of how the story is. I have written out our whole story if people are interested on my blog at womanhoodwellness.com/blog. But what I'm interested in knowing is sort of how your experience was. So I guess you can keep chatting through it. You don't need to necessarily relay the whole
okay.
story
Okay.
in
All right.
chronological order.
It was an emotional roller coaster, because every time I got a new piece, I tried to latch on to that diagnosis or something as the answer, and almost everything had a solution. So if it was heavy metals, we can go and I can do 2, 3 IVs a week and chelate it out and sweat it out. If it was toxicity, I can take the right supplements, the right herbs. I can sauna and sweat it all out. If it was varicoceles, they could
Mm-hmm.
fix it surgically. If if it was a plumbing problem, maybe they could fix it. Whatever it was, there was always this. There always seemed to be a solution to the whatever problem we figured it must be. And then every time we fixed one of the problems and then went to test, and we had this is by the way, this is incredibly time consuming. So we'd fix a problem, and we'd have to wait 3 to 6 months, and
Mm-hmm.
then we would go in being like, all right, we must have had it. We must have figured it out. We got the root cause, fixed the root cause. And then every single time it basically stayed flat. It was no sperm, no sperm, no sperm. So it was like high moments where we kind of figured it all out, and then really low moments when none of them worked.
Mm-hmm.
None of them. So yeah, it was crushing.
And what was that like, going to so many different doctors, so many appointments, because we started investigating your gut health, and we did all sort of different functional inflammation root cause stuff, and we did the varicocele surgery before I became a doctor because it was 2 more years before I graduated because we found your toxins because I ran those labs. So I was already licensed at that time and I found it because you had a high homocysteine. But basically, what was it like to just be kind of shuttled from doctor to doctor and have all of these high and low moments? Like for other people going through this, what was that like? And what would you say for someone who's just starting this journey?
I would tell them that it's not always complicated, but it can be complicated, especially in cases like mine, where there's multiple factors causing it.
Mhm.
And we still, even to this day, we don't know with 100% certainty what my issue was. So having patience um, is incredibly important, and maintaining a positive attitude. I mean, I don't like when people. The worst thing is when people say, "Oh, you'll figure it out. There's always a solution," and it's almost like false hope. So it's like it's a for me it was a balance of maintaining a positive attitude and kind of releasing expectations and just kind of matter of factly going through each one. Um, and then I mean my I guess my advice for a man going through this um, is don't be afraid to get more information. Don't be afraid to just go get the information that you're afraid of learning. For me,
Mhm.
is like I kind of don't want to do this crazy genetic test that costs $1,000 because it could be more bad news. So it's like I can just kick that off into the future, or I don't necessarily want to do a sperm analysis because I don't really want to know the solutions or the sorry the results. And so I think delaying because you're afraid is the worst thing. Just rip the bandage off. Go do the test. Figure out what's going on, and get to an answer quicker than what we had like what, 6 7 year journey before we actually were successful.
Yeah, six
So
years.
yeah,
Yeah,
it was
so that's a good point because a lot of men that I see and a lot of men of women that I see don't want to test or they don't think anything's wrong with them. Looking back now, we obviously found out about your sperm in a roundabout way. You didn't just go in and get a semen analysis, but was there anything in your case, in your history that you felt was red flags that now looking back, you're like, I wonder if that was something that would have jogged me to go check my sperm at a younger age or sooner in the journey? Is there anything for you?
I mean, in hindsight, there were a lot of things that I did that make me question whether they were good decisions. Like there's, for example, like spraying pesticides as a teenager for my job. That was probably not a good idea, at least without a mask or anything like that. And we're not wearing gloves when I was working with chemicals. Those are all things. But as far as like in hindsight, is there any way? Was there a red flag that could have told me? My ejaculate has never been white, so that it's never been white. It's always been some form of transparent. Um, and so that was probably the only thing that could have given me an idea. I mean, varicoceles, when you're hot, like if you're, when working outside, you should be able to feel varicoceles yourself. Just like they call it a bag of worms. You should be able to feel that. And they're not always present. Like I used to be mine are fixed, but when I did have them, I only felt them sometimes. Like after the gym, you'll feel them. But
And did you know at the time what it was you were feeling, or you didn't really know? You just knew you felt something.
a urologist once told me that they were varicoceles, but it was no big deal. It's not like a life-threatening thing.
But he never warned you about fertility.
No, I don't think so.
That's so crazy.
Um,
Um,
I mean, I bet at the time, but at the time that I was told I had varicoceles, having babies was not on my mind. The doctor may have said it, and I was just not paying attention. Like, what are you talking about? That's in my future. But I
mhm.
don't remember being told, and I had no. When you told me that I had no sperm, that was the first time I had the inkling that I had a reproductive problem.
Mhm.
Besides the
Yeah,
fact that my sperm was never my semen was never white.
right. But most men probably wouldn't know that that's abnormal. So, what are some other things that you feel? So, based on our findings, you had the varicoceles, you had toxin exposure, potential toxin exposure in utero when you were a baby, and then a genetic issue that we found at the very end of our infertility. Even though the fertility doctor checked it initially, he never told us anything about it. He didn't tell us the results of the cystic fibrosis associated disorders mutation that we think maybe affected the development of the vas deferens, which is where the sperm comes out. It's like the tube that allows it to come out. We found that out by doing genetic carrier testing in prep for IVF. So, what was that like to receive that information, which we found out because I did that test and it came back positive for you? And I just started looking into it and found that that leads to male factor infertility. No one had told us this. What was that like to hear that?
So that diagnosis or hypothesis made the most sense to me
Mm-hmm.
because it seems like a plumbing issue. Because my case is kind of I don't know if it's unique, but I developed normally
Mm-hmm.
physically.
Yep, very
I
physically
have
normal.
I have body hair. I have a beard, like I'm a
Yep.
dude,
Yep.
and yet I have no sperm. And
Yeah,
so
there is
the
no
doctor,
sign of you physically or like
right? And so that
sexually that there's anything wrong.
yeah, and so a plumbing problem seems to make the most sense. And so that's for me that was good news. It's basically just more information. Um, and so it was almost relieving. Not that I want to have cystic fibrosis like related disorders. I don't want that.
Right.
But if it's just like the highway's blocked, then at least it explains why I am normal male with testosterone that just doesn't have sperm. But yeah, there's a lot in my history that even more than what you said. I mean, yeah, I was exposed to fluoride tablets, like heavy amounts of fluoride. I had amalgams, fillings in my mouth, silver fillings with mercury.
Mercury. Mm.
I used to spray commercial grade insecticide sorry, not insecticide, herbicides in Colorado when I was a teenager and in my early 20s. I was a nuclear engineer. I mean, I stood on top of a reactor core for years, not 24 hours a day, but for a long time. I don't think that contributed. Honest opinion. I don't think that had anything to do with my problem. But I did a lot of things. It's like, which one was it? There were so many things that it could have been. And the cystic fibrosis stuff, which plays a role, especially with my heritage, seems to make the most sense. So the problem with that is that's not a super easy fix.
Right.
And
And
so
tell them a little bit, if you feel comfortable, about the intuitive that we saw before we found that diagnosis, if you want to share. If not, it's okay.
well, that intuitive is my mother.
Yeah, and she's amazing.
Yeah. Actually, I had a vision. That this vision kept me going. I think about this vision all the time.
Yeah,
That
I just want to, before you begin,
yeah.
this journey was so hard, and we'll get into some other things, but it was a lot of science, a lot of investigation, and then there was a lot of emotional breakdown that we both had, and then a lot of spirituality and faith that really kept us going. And so I just want to weave that kind of through, because that's the reality of our journey. So yeah, keep going.
So this vision happened in my sleep, but it's not a dream. It was more than a dream. It was a message. There was a significance to it, and there was very clearly a message that was being delivered. And in this vision, I walk into a room, and the angel of death is standing there, and he's huge. And he has a scythe, and he's, I can't see his face. He's got bones for hands. And I look at him like, bro, no, like he's an old friend, like not afraid of this guy. Like I met him 100 billion times before, and I just see him, and it's like this time, like I'm not ready. And it was like an old friend. Honestly, it was bizarre because he
Mm-hmm.
felt like I knew the angel of death. I knew him, and he wasn't evil.
Mm-hmm.
It was just like his role was to cross people. but I didn't know why I'm seeing him. And I felt as though he was about to take me across. And then he walks up to me and he takes his hands, his bony hands, and he sticks them into my torso. And he grabs my liver and he pulls out my liver. And he holds it up and he's showing me this bloody liver. And if you ever go to Subway sandwiches, and you're looking at the roast beef, you'll see it like glistens, like metallic. It looks dead.
Ew.
It's like it looks like somebody like dripped oil on it. That's what it
Ew.
looked like. My liver looked dead. It looked lifeless. It looked diseased. And he's holding it in front of my face, like right in front of my face. Like, look. And I'm like, I get it. I see it doesn't look good. And he's like, no, look. And I kept, being like, okay. And then he did that like 3, 4, 5 times. Just look. And then he takes my liver and he tears it in half. And he shows me the inside. And sorry, I got a cat here. He shows me the inside. And it's candy apple blood red. Like, we're talking the most fluorescent, vibrant red you've ever seen. And like just the shoes in Wizard of Oz, like super super vibrant, healthy, bloody. And he did the same thing. Look, and I'm like, okay, look. And then he takes the liver, puts it back together, and sticks it back into my body. And then I wake up, and I'm like, oh shit, I'm dying of liver cancer or liver failure or something like that. And
Mm-hmm.
I was actually really concerned. And I told you, I was like, I think I need to go get my liver checked. I think this
Mm-hmm.
was a message that I got a problem. So we were actually heading to Europe for a trip, you and I.
Mm-hmm.
And so I called my mother, who is she's an intuitive and she's great. And I told her like, hey, I just had this vision. I think I'm sick. I think I'm dying. And I told her the vision, and then she called me back when you and I were on a train. She called me back and she says, "Hey, I got the download on what that was." And she's laughing and she says, "They didn't mean to scare you. They wanted to send you a message in a way that wouldn't freak you out, and clearly it didn't really work." She says the message you were supposed to receive is the life is on the inside, even though when it looks like it's only death from the outside. So she says the message is there's life on the inside of your testicles. There's no life, even though it looks dead from the outside.
Mm-hmm.
So that was a huge moment for me because, first of all, everything clicked there. And she says they didn't want to grab your balls and tear them out of your body. They thought that would freak you out, and it just would be a very unpleasant experience for you. So they went with another vital organ you can't live without, is the way she put it.
Mm-hmm.
And so when we went on that trip, I felt in my soul that we could have babies. They just had to go in and do testicular retrieval.
And this was before we found out about the cystic fibrosis gene. And Jessica also had in a meditation with you where she felt like she could sense the sperm were in there, but they were getting stuck in a maze, like they couldn't get out.
She felt like they were almost like confused, like hitting roadblocks. Like, why can't we get out?
Yeah. And this was
Um,
probably a month before we did our genetic test, and about 2 months before we ended up doing IVF with testicular retrieval. And so that meditation and your vision honestly brought me more peace than anything that we had. And when we did that genetic test and found the cystic fibrosis, I felt like it clicked in such a powerful way with the intuitive guidance from her, with your message, and then with this new piece of genetic information. Those were the 3 pieces of evidence that we were going into IVF with, because on the outside, it looked like you had no viable sperm. And we were going based on those pieces of information and faith and hope that you did have, sperm on the inside, which was really, really wild. And I just think it's a really cool story.
the the doctor, the Western doctor that I was going to, the urologist, he wanted to do what's called testicular mapping, where they basically take biopsies of the testicles in different. They like drill for oil. They're looking for pockets of sperm.
Mm-hmm.
And that's not a fun procedure to go through. And I decided against doing that because I just believe so strongly in the vision that I'm like, there's sperm in there. They're gonna find sperm when they go. So I'm not gonna go through another procedure. I just had healed up from my bilateral varicocelectomy. Like I said, that
Mm-hmm.
wasn't fun. And they're going to go and they had to do testicular retrieval anyway. You can't get sperm from a needle. That's
Mm-hmm.
at least that's what we were told. You can't go in with a needle, find sperm, and use that for IVF. They had to go in there, cut everything open, and take tissue. And so we decided against testicular mapping, really because of that, because of our faith in that vision.
Yeah, which was crazy that that led us. So before we got to this point, though, we had 5.5 years basically of trying to figure this out, go down all of these pathways. And before you had your vision, before your mom had her vision, and before we had the data about the cystic fibrosis, we really were at a point where we were getting to like our wits' end of not thinking that this would ever happen for us. We This is something that a lot of people going through male factor infertility have questions about, which is how do you make this decision to keep going, keep investigating, keep trying versus looking to sperm donors or adoption? And what was that like for you?
Um, I for me it was very important. It was important to me to have biological children. Like I wanted to have children that had my likeness. As that some people would call that jello. I That's something I wanted. I wanted to have children of my own, and I was, I kind of had made peace with the fact that it wasn't going to happen. I did make peace with the fact it wasn't going to happen, and so yeah, adoption for me was kind of a last resort. You know,
Mm-hmm.
I'm I think it's wonderful, and there's absolutely a possibility we do it someday. But at the time, I wanted my own biological children, and
So that was the drive that just kept you going.
yeah, and also, you want your partner wants kids, and your partner, wants to be pregnant, and I want you to be able to go through the the you know the motherhood process, because if we don't figure something out, we either use a donor, and you carry that child, but I kind of wanted you to carry my child. That was the goal. You carry my
Mm-hmm.
child. The backup was you carry a donor, and then
Mm-hmm.
the third was going to be just full on adoption. But the sad thing with adoption is if you never get to you never get to go through that process. So my goal
Mm-hmm.
was to give you that, and I did make peace with the fact that that might not happen. So my drive was really to give you that.
Yeah. And speaking of that, everyone is different, everyone's experience is different. And I can kind of step into like the interviewee role here and the doctor role and kind of detach myself from the journey. I've done so much of my own work throughout this process, and you have too. But I'm just curious what it's like from your perspective, being the man in male factor infertility when your partner wants a baby. I have my own experience of what it's like being the female in that situation, but what is it like being the male in that space?
I think it's identical to the way a woman who has reproductive issues would feel. I think it's identical. Maybe it's a little different because as the man, you also take on typically the provider role and the protector role, and so you've got, you want to provide and you want to protect, and not just, provide money and protect from harm, but you want to provide um, the experience of motherhood and protect her emotionally and spiritually.
Mm-hmm.
So like the provider protector thing plays in all aspects of a person. And so yeah, you whatever a woman would feel going through reproductive problems, that's pretty much I think what I felt. You have insecurity for sure. But, well, what does my partner want to be with me if I can't give them children? And then you have, you think you're lesser than, there's something wrong with you. Oftentimes you wake up thinking you're broken, go to bed thinking you're broken. Um, it's emotionally traumatic. It's traumatizing to go through it, and there's a lot of guilt. Um, yeah, it's not fun. It's not fun being going through that. And then
So,
there's also a huge burden financially that we are self-employed. We have a health share that doesn't cover any of this,
mhm,
so we've had to come up with an insane amount of money, and that's a huge burden.
mhm,
It's 150, $160,000 to get our first child. And so that's financial stress you're adding to the family. In addition to all the emotional stress, you're adding financial stress, and it's not guaranteed. That's the other thing. The IVF is never guaranteed. So we're spending this money. We're doing these procedures. I had 2 surgeries. You had one. To actually, you had two. I had two to get AV at the end of the day.
mhm.
Um, yeah, it's a huge undertaking on every level to um, to give it a go, and it isn't guaranteed. And I think you really do have to hope for the best, but have reasonable expectations. And um, I had given up hope many times. There were
Mhm.
many days when I was like, this is never going to happen. I'm going to go through it. I'm going to do this procedure, or I'm going to go do this test, to make my partner happy, make you happy. But there were days, not all the time, but there were days when I was just doing it just to make you happy, thinking that this is never going to work.
Yeah.
You know,
So going through it, it's so hard on you physically, mentally, emotionally, financially. What were some of the things that you felt like were helpful to help you process and navigate that? And what were things that you wish you had more of in hindsight?
um, well, I felt like I was going through it alone at the time. I had no idea who else was experiencing male factor infertility. Um, None of my friends that were experiencing that. Everybody seemed to get pregnant, easy. And so I felt very much alone. I had nobody who had been through it. I had nobody to talk to. I wasn't really seeking it out though. I wasn't like, looking for support groups. I'm not really one to go to support groups, but
Right.
I felt very much alone.
Just like, what would you have wished you had had more now that like you've been through it? Like if someone were in your shoes navigating male factor infertility, I know everyone's different in how they get relief and you're not much of a talker, but just in general, if your buddy came up to you and said, hey, I was just diagnosed with, male factor infertility, like what would you tell them
I
would
would,
be good for their own sanity going through this?
well, I think having the support team from a medical perspective is important, and the right team, because I feel like making the decisions to go through procedures and surgeries and all this stuff. Um, it's already challenging, but when you have to doctor hop to find answers, it's even more annoying. Um, and so I think the biggest support for me would have been having all of the possibilities for male factor and fertility laid out on the table, and that was never the case. It was very much piecemealed here and there. Like here's a little thing. Go chase this for 6 months, and then go. Oh, did you think about this? It's like there was never a single laid out plan that we could just follow. And everybody's unique. I get that. But there's like no path where it's like, okay, first thing you need to do is rule out, lifestyle stuff. Stop going to the hot tub, stop going to the sauna. And then if that doesn't work, go here. I didn't feel like we had that. I feel like we're doctor hopping. Some people would have great ideas. We'd go to a treatment. And then when we'd hit the end of that road, we'd go to another doctor. And so I did not, even though we ended up, having success, I felt like it was very stressful for me to have to go out and seek the answers and find the doctors that knew the stuff, all of the stuff. Everybody seems
Right.
to know pieces.
Hmm. That's really funny that you even say that because we didn't talk about this at all, but that was like a beautiful lead in to what I created, my course, fertility formula, and like the male factor part. I always tell people I created this course to be what I wish we had had along our journey, where it is all laid out. It's all right there, organized. And on my male factor part of the fertility formula, I actually created a map where you literally follow it to go step by step. You wish you'd had maybe more support, people to talk to.
But yeah, one
Yeah.
more thing, one more thought on that. I found out much later a lot of my friends were going through male factor infertility and not talking about it. Seems to be something men do in silence.
Yeah.
They covertly go through these problems, and a lot of them have they don't want to talk about it. They don't want to bring light to it.
Mm-hmm.
It's not. They're not calling me up for support.
Mm-hmm.
I feel like it's just something that we guys do is suffer in silence. But had I known, there like I even have colleagues at work that are going through this, and it's like,
Right.
we could have talked about this. We're all going through it together. So there was. I feel like if you have 10 friends, 10 guy friends, there's one of them's probably experience, and they're trying. One of them's experiencing infertility and
Yeah.
of some kind,
That's
and it's
exactly, you're actually exactly correct. That is the statistic, 1 in 10. You don't even know that, and that's how
no, I
much you
don't know
know.
that.
I know. Good job.
No, and I haven't even seen your course outline, so I didn't even know that you did that. But that's cool.
That's so funny.
Um, so yeah, that's great. And then emotional support, by the way. I don't like being gaslit. I don't like when people tell me, "Oh, it's going to be fine," and "Oh, they're going to figure it out," and you'll have kids, and "Oh, the surgery is going to work. It's going to be 100% successful." Even though I'm a huge fan of being an optimist and manifestation, like I'm a huge believer in the power of manifestation. Um, it just rubs me the wrong way when people just don't really understand the struggle and just say, you know, yeah, this surgery is going to fix it. You're going to have kids next year, and it's going to be wonderful, and blah blah blah. It's like, you don't know that.
Mm-hmm.
Just say good luck. I wish people would just say good luck,
Mm-hmm.
and not try to give me false hope. Make
Mm-hmm.
sense?
Yeah.
Good luck is way better than all this other stuff.
Yeah.
I can manifest myself, but that's just me. That's my personal preference. Maybe other people, maybe they want the opposite. But for me, good luck, bro. I hope it works out. That's what I want.
Yeah. No, you're not alone. That's very common in the infertility sector of not being told all of these things. So, one of the questions that people sent in on my Instagram was, what would you want from your partner? Like, how, you being a person going through male factor infertility, what would you wanted your partner to do or be or say to support you through this?
Exactly what you did. I thought you did a great job.
Oh, what was that? I
Um,
don't, I don't know what I did.
so I can't be. First of all, I can't be your therapist. I can be your husband, and I could talk about stuff, and I could talk about your emotions. We could talk about things. We don't have to like completely shut off like emotional stuff. But you had either professional counselors, therapists, or you had friends, and so I wasn't your only emotional crutch. If you make your partner if the person who is going through infertility is also the emotional crutch and is watching their partner like in their broken down moments, that is not the good for the person going through infertility, because then you have to be the strong one and you have to say, "Oh no, honey, it's okay. It's okay. You're okay. Everything's going to be fine," even though you're the reason they're crying. So, yeah, if you're the partner that is not having infertility, talk to people, have your own counselor outside of your partner. I think that you did that. That was very helpful. The other thing that you did that was really helpful for me is you said, all the time. You remind me all the time. It's okay if this doesn't work. It's it's okay if this procedure doesn't work.
Makes me want
It's
to
okay.
cry.
Yeah.
Mm-hmm.
You reminded me that, at the end of the day, we could be dinks. We can have dual income, no kids, or we can adopt. And so you always reminded me that the worst case scenario is fine. We'll make it work. And you reminded me that it's not gonna end our relationship. You said that repeatedly. That this nothing's gonna get in the way of our relationship. And you reminded me, um, yeah, I mean, you were a huge support for me. So yeah, to summarize, you having your own people to vent to was very helpful for me. I can't be your counselor. And then you taking the pressure off, just lower the expectations, be realistic, don't gaslight me, and remind me that our relationship is strong. Our relationship is not riding on the success of this. That's huge. Diffuse that situation immediately and constantly. Don't say it once. You got to say that quite a bit. That this isn't a make or break for your relationship, and
Mm-hmm.
then that it's okay if it doesn't work.
Mm-hmm.
Like, it's okay. Um, so
That was really sweet. I don't think you've ever told me that. Thank you, honey. So, in that realm, I had the question and it's totally left me. You've kind of hit on a lot of these questions that we got from Instagram. So, you said the things. Yeah, was there anything else I said to support you emotionally?
I mean, you were there. You were there in all aspects. You were supportive of what I wanted to do and what I didn't want to do. It takes two, going through IVF and going through not just IVF, but all the stuff to get to IVF. If you go through the journey, um, everything is a decision. When you go and do like for heavy metals, it's like $300 for an IV to do chelation. You got to do like 20 of them. It's a huge commitment. So if I said, yeah, I want to go through with chelation and I want to go to 260 hours in the sauna for that, if I said I wanted to do that, you supported that, even though that would basically take like 6 months to a year out of our journey to go try this. So you were supportive, even though we made decisions as a team. If I said I want to go try chelation, or I want to go try this procedure, or I don't want to do testicular mapping, you were supportive of those things.
Mm-hmm.
And you did a good job of motivating me to keep going without pushing me. You didn't like push me into these procedures.
Like how did I do that? Like for someone who is trying to navigate this, like give them an example.
Um, like I knew how important it was to be a mom for you. So I didn't really need a whole lot of motivation from you, but you did a really good job of you know motivating without gaslighting, being like, hey, this could work. You don't know. This procedure, it's gonna suck. Healing from it is gonna suck. It could work though. We don't know, but I think it's worth a shot. Like that type of conversation is
Mm-hmm.
great. You need to do this. I want a baby. Not good.
Mm-hmm.
Or you need to do this because it's going to fix everything and we're going to have babies. Not good.
Mm-hmm.
Like you have to be realistic. The expectations have to, you have to be within reality. And then, if you do have to go through surgeries, recovering from those is not fun, especially in the groin. It's really,
Mm-hmm.
really not fun. And so your partner to be there to understand, like, all right, you're on the couch curled up in the fetal position for a week times 2, 3. Um, there's a lot of love and compassion for that. It's tough. It's really,
Mm-hmm.
really tough getting surgery on your groin. Like,
Mm-hmm.
um, it's very painful. I healed both surgeries, the varicocelectomies and the testicular retrieval. I healed in the fetal position, and then you go to stand up straight, and no bueno.
Mm-hmm.
So yeah, don't like they're legit. They're probably not nearly as bad as a C-section. So preach on the choir here, but it's still not fun to go through. And your partner does need to realize like you're gonna be down for a little bit for those
Yeah.
in those particular surgeries.
And speaking of that, one of the questions on Instagram was about Tessie recovery, and Tessie is testicular retrieval, essentially.
Yeah.
We had to do that for IVF. And what was that like for the recovery? Do you have any tips on like supplements or lifestyle practices or stretches or anything to help if people have to go through that? Or even the varicocele recovery?
I mean, the only complications I had, which I did have with both, were the sutures. For some reason, dissolvable sutures do not dissolve in my body.
Okay.
Maybe you need sperm to dissolve sutures. I don't know. But both times we had to go in there and physically remove the sutures. Which, so I don't know if other people experience that, but that's not pleasant. But the question,
Just like recovery, was there anything you did that helped?
I took homeopathic arnica. I always do if I have any type of bruising or surgery.
Mm-hmm.
So yeah, homeopathic arnica speeds it up. I would definitely not. I would definitely not. It's okay to rest in the fetal position or with your knees bent, but stretch them out every once in a while. You know, like go for a walk. Try to lay in bed a little bit straighter, um, and then also on the scars. For I had, let's see, one, two, three. I had three big incisions, and they all go away. They're all gone now. But yeah, I was actively like doing scar work to get them to go down because it doesn't. It's scary for a while, and then eventually they will fade as long as the sutures come out.
Mm-hmm.
But as far as like, I just followed the doctor's orders. The only thing I did that was extra was homeopathic arnica.
Yeah. And for anyone listening, vitamin C is really good for post recovery. And then proteolytic enzymes in between meals can help to break down that scar tissue. And then, like he said, manual massaging of the scars after obviously they've healed is helpful. Speaking of motivation with men, it's just really hard, I think, for a lot of men to be motivated to get a sperm test or to take supplements or change their diet or change their lifestyle or go to these things. Like what would you tell either a partner of a man on what's a great way to help encourage and motivate guys to make these big changes without feeling like you're being told what to do or like without being, you hate being told what to do. And so but there's a reality that women, for the most part, are the ones learning this information and they have to go tell their partner. So, what would be your advice for them?
Motivate men to go and study and find out if there's a problem. I would say it's to figure out what's preventing them from wanting to. I think a lot of it is fear based. I think most men don't want to know. They'd rather not know. They'd rather try forever, have a really good time trying, than find out there's a problem. And
So, then what would you tell the men in those situations?
if you really want kids and and it's important to you or your partner or you and your partner, and if you've been trying for months and you're not getting anywhere, either you're not getting pregnant or you're not keeping, I would say get checked out. It's very common. Male factor infertility is very very common, and we're not all the same. Like there's different problems. Some people are really easy to fix. Some people you fix the varicocele and it's done. They're good to go. But the sooner you get the answer, the quicker you'll get to a conclusion. For us, if we had waited, if we didn't find out how if we didn't find out when we did that I had no sperm, our
Mm-hmm.
journey would have been way longer. We would have probably been in our 40s by the time we had Avi,
Mm-hmm.
because it just takes time to figure this stuff out. Unless you go right to the end. Like if you
Mm-hmm.
go and you just go into IVF, just cold, you say, all right, we're not getting pregnant into IVF. That's different. We
Yeah,
went down
but
the journey. We went down the healing the root cause journey.
right,
Um,
but what I always talk about, which I believe so strongly, is why we see so much failed IVF is you did all the lifestyle shifts. You changed your diet. We got the toxins out of your body. You did the IV chelation. You changed your varicoceles, which changed the oxidative situation in your body, because men who have these issues that don't make any changes, who go to IVF, will still come out with poor quality sperm, poor quality embryos, failed transfers, unhealthy babies. So going to IVF isn't a guarantee. Like, you have to work on all of these things, at least in my opinion, to have the best outcomes even in IVF.
Yeah, and I'm glad we did. Like, I think we got four really good embryos from my not so great sample. I
From
think
testicular
probably because
retrieval.
we
Yeah.
we went through all of the steps to rule things out, for sure.
Yeah.
But as far
Okay.
as
So,
like going back to your original question, how to motivate guys to go get a sample, just tell them it's important to you. Just say, babe, it's important to me that we just have this answer. Can you please just take the test? And I'll make the appointment. Just go. It's easy. You do it all the time. Just go, give them a sample, and let's just rule you out.
yeah. And another question that we had on Instagram was support for low morphology when count and motility are good. For anyone who doesn't know the details about sperm, I have a free guide at my website, womanhoodwellness.com/sperm. You can download my free sperm analysis guide for when you do a sperm analysis, which you can do on your own. And I tell you kind of the optimal ranges. In my fertility formula, I dive deeper into male factor infertility. But for morphology, something that's just come up recently with a patient is if you have poor morphology, it's often a toxin issue, poor quality diet, varicocele. So make sure you get ruled out for varicocele, and or check for round cells in your semen, because if there's round cells, it could mean that there's a bacterial issue, either a low grade infection or some sort of imbalanced microbiome. And there's a test that you can do to check that. So all of that information is in my fertility formula, but there's sometimes more than just supplements to take for morphology. If you want to learn about what supplements I recommend, it's all in the fertility formula. So just check that out at womanhoodwellness.com. But to wrap up our episode, honey, we went through such a long journey. It was so emotional. It was so trying at times. I just have three things. The first thing is, what advice would you give for couples on how to maintain a strong relationship during this process? Like, what did we do well, or what would you recommend couples do? Because a lot of people going through infertility struggle in their relationship.
Just put your relationship first. Continue to do date nights as much as you can. Try to keep levity in this subject. Laugh at things. I laughed at. I started to laugh at my semen analysis when they kept coming back with zero. It's like, you have to keep it light. Life's a journey, and even though it's difficult to go through, it doesn't need to be more difficult than it needs to be. So I think supporting each other, keeping your relationship strong, realizing you're both going through it, even though maybe one of you or maybe both of you have problems, but you're both going through it. So have compassion for each other. The person who has the problem is not necessarily the one who's suffering the most. In our case, I think it was you that was suffering the most, even though I was the one with the physical problem. And one, I think a very important perspective that I've always had, and sometimes I lose it, but I typically always get it back. Is the fact that I see my body as a vehicle. I personally believe in the soul and the body, the physical body, and so um, I see my body no different than I see my pickup. And if my pickup has, a funny sound, or it's got an issue with the engine, I take it to the shop. I don't go and hide that from my colleagues and my family and say, "Oh, I'm so embarrassed that my engine has a problem." So it's just a matter of fact. It's like, yeah, I have no sperm. my body has a physical problem. It's not me. Having no sperm doesn't make me less of a man. Doesn't make me, broken. It's just my body is not me. It's my vehicle. So when I go and get bad news, a doctor telling me that there's a problem with my physical body is this. I have the same emotional response that I have if they tell me something's wrong with my truck. It's the exact same response. It's like, oh shit, or how do we fix this? Right? I don't have a problem. My body has a problem. And that perspective has been very helpful for me. You know, I think a lot of men feel as though they're less of a man and they don't want to talk about sperm count and they don't want to talk about male factor infertility because they think it makes them less masculine. Um, it doesn't. It doesn't at all. And so, yeah, I would encourage people to kind of potentially adopt that same kind of mindset. It's just a hardware. This is a machine. It's literally a machine. It's electrochemical. It's actuators. And if it has a problem, it just has a problem. Think of it very matter of factly. Think of it like an investigator. A little more difficult to fix than a vehicle, but it is just hardware. And my that's my personal belief, and that's the perspective that really really has helped me navigate this journey and stay positive and stay matter of fact and handle news and test results from a better place.
And you also had a really profound spiritual awareness during one of your spiritual awareness practices that your body is, yes, your physical vessel, but also that it is doing the best it can. And to like
Yeah,
really love your body and treat it like a child because it's not betraying you. It's not something you should punish or be mad at. It's like it's doing the best it can. And like every supplement you take, every time you go to sleep, every dietary change you make, all of the things that you're doing is to like help this beautiful vessel that is trying to do the best it can.
yeah, that was also very very profound. Having compassion for your body. Um, yeah, that was on ayahuasca. Anybody who's
Yeah.
open to ayahuasca, and and yeah, that perspective. I mean, I had that when I was younger. I lost that perspective for a bit. I began to get angry at my body. Why aren't you working? Why do I have back problems? Why can't you recover? Why are you constantly getting injured? Like I kept having anger towards my body. And maintaining the perspective that your body is doing the best that it can. By the way, in this experience, my body was basically saying, I'm doing the best I possibly can. Take it easy. Like, just cut me some slack. I'm working on this. You don't even know the things I'm doing. Like, cut me some slack. And, and so I have a lot more compassion for my body. And now, I got injured 3 weeks ago. I just spent 2.5 weeks on the ground because of a back issue. And I give my body the space it needs to heal. I'm not angry at the body. I'm frustrated. I get frustrated, but I don't harbor anger towards my physical body anymore. I have compassion for my body, and I'm frustrated that I am on the floor for 2 weeks. Very different.
Yeah.
It's okay to be frustrated, and it's okay to be angry, but putting anger towards your physical body doesn't help. Makes the problem worse.
Right. Ah, you're so wise. Okay, I just want to end. We're wrapping up with our whole journey. We went through IVF. We were together when we took our positive pregnancy test. What was that moment like? And then what was it like when Avi was born?
Um, I would say that when you had the positive pregnancy test, I was actually suspicious. It's like
So many negatives for so long.
that maybe it's a dud. maybe maybe you didn't do the test right.
But this
And
was
then
after
I was
IVF.
like, I was trying not to get my hopes up either because so many people lose the baby early, and I just didn't want to get my hopes up. And so I was guarded. I had a very guarded heart, even though I was really thrilled and I was happy. I was
Mm-hmm.
afraid to be too happy. And in fact, the entire pregnancy, I was afraid to be too happy. I
No, wow, I
think when
never
the
knew
baby
that.
started to move, when we started to feel kicking, that's when I was like, all right, this baby's strong.
Mm-hmm.
And that's when I kind of shifted towards, this is going to work. And then I thought both of you were going to die during your labor. It was horrible. Like your labor, I was convinced you guys were going to die. Because we went to the hospital, emergency C-section. We get there, they're like, you can still labor for a little while, but you pulled your back, you were sweating, baby was stuck, she wasn't coming. Then they're like, yeah, the baby's not in a great spot. We need to go in there and take her out. And you don't handle medications very well. You're sensitive. So I was just like, this is not going to go well. Once again, big fan of manifestation. That was my internal dialogue. I was a little bit afraid in the situation. So I try to be positive, and it all worked out. Best moment of my life was when she was born. Like, hands down, best moment of my life. I was crying. Everybody, for some reason, the entire operating room was full of people during COVID. Everybody's wearing a mask. There were like 25 people in the room.
I know.
Everywhere was a person. Maybe they were bored. I don't know. Maybe I don't know. They were curious, or maybe they were in training. Maybe they were student doctors. But the room was packed, and everybody's looking at me cry. I got my shirt off, wearing a mask, and rocking the baby. And I mean,
you did skin to skin because I couldn't, because I was completely numb. I couldn't hold her. So you ripped your shirt off and did skin to skin in the OR, and it was amazing.
Yeah, it was an incredible day. That was the best day of my life.
Oh,
and the most terrifying.
Yeah,
absolutely terrifying.
Oh, well, it was all worth it.
They said the doctor at one point, she looked at me, the OB-GYN, who was going to do your surgery. And she said, you're going to meet your daughter in 8 minutes. And when she said that, I was like, what? Like, you serious? 8 minutes? She said, count down, 8 minutes.
Oh my God.
And I like that. I still think about that. Like, that's so bizarre. You're going to meet somebody that you'll know for the rest of your life, God willing. And you're gonna hold that person in 8 minutes. It's so bizarre. Being a first-time parent
after 7 years.
Being a first-time parent is like, it's a wild experience. It's an absolutely wild experience. So
I'm so glad that we were blessed to be able to have that experience, and I hope and wish for that for everybody else listening. If anyone's struggling with male factor infertility, hopefully this episode brought you some valuable information, some insights, some paradigm shifts. And for anyone who wants, data and practical steps and investigation support and all of that, again, check out womanhoodwellness.com/fertility formula, or you can take my free quiz at womanhoodwellness.com/quiz, and it will tell you your fertility type, which then will direct you to the correct fertility formula for you. And thank you, honey, for being on and sharing so vulnerably all of the things. I think it's really going to help people.
My pleasure. Hope it's impactful in any way.
Thank you.
Thanks for listening to this episode of the Healthy as a Mother podcast. In order for others to hear this information, please leave a review with Apple Podcasts, subscribe, and send to a friend who could benefit from this content. We're so excited to share more on becoming and being a mother next time.
And please remember that the ideas and views of this podcast are for informational purposes only and are not intended to serve as a substitute for medical care of any kind, including the diagnosis or treatment of any illness or disease. Consult with your provider before integrating this information into your own care plan. And remember, a healthier future starts now, and it starts with you.